welcome to the Friday Checkup with Dr. J. This is a little different because we've had a crazy week and it's a crazy week ahead. So I'm filming from the backyard with the fire, and don't mind the dogs if they come running by. But this week I'd like to talk about sleep. I get a lot of questions in the office about sleep in various stages of your children's lives. So let's jump in and talk about newborns first. The newborn mom, I get this question all the time. How much should my child be sleeping? My child doesn't want to sleep. My child sleeps too long. I have to wake them up to feed them. What is normal and what do I need to expect? So newborns need to wake up to eat every few hours. We do recommend in the office, but until they're to their birth weight, they should be eating every 2 hours during the day and about 4 hours at night. So if your newborn is sleeping more than 4 hours at a stretch, we do recommend that you wake them up, and please do not expect that your newborn is going to sleep through the night. You signed up for this parenting thing, so welcome to sleep deprivation. Once they get a little bit older, usually between 4 and 6 months, they should be able to go about 6 to 8 hours without needing to eat. So they should be able to get a good chunk of sleep at night. People ask me about sleep training. There are different methods out there. I do recommend, and Dr. Bassett recommends, the Ferber method. It's F-E-R-B-E-R. You can Google it, and they will teach you step by step how to sleep train your child. What this is going to do is teach them how to self-soothe and kind of get themselves, you get them like drowsy and you put them in the bed, and then you go and check on them in intervals. So it's like 3 minutes, 5 minutes, 7 minutes, 10, 12 minutes, and then you repeat that, and you do this in a cyclical fashion until the child can learn to calm themselves and go to sleep. It's a great method. Again, it's Dr. Ferber. You can Google it for more information. The next stage of development, I would say, is around the toddler age. They usually give up that nap time around 18 months. And this time, some of you might be expecting your second child, so you're wanting to transition this child into a toddler bed. The most important thing when you're transitioning to a toddler bed and you're going to be leaving your child in the room is please do a safety check. Crawl around on your hands and knees, check all the outlets, check and make sure that the bookcase is secure, that the dresser is secure. There's nothing that they can pull off a shelf and injure themselves. So first things first, safety. Then you want to go back to what we talked about several weeks ago: predictability, routine, structure. You want them to have a sleep routine. So you want to start to establish something that you're going to do every night, like a sleep ritual, so that they know what to expect when they go into their room and they're supposed to go to sleep. There's some other methods that we can talk about in the future, but again, safety, routine is going to be your best bet at the toddler stage. The next stage is going to be more of the school age. Again, important for the routine, the consistency. They are going to have maybe some nightmares at this age. You just want to do some reassurance and calm them down. There is a difference between a nightmare and a night terror. The nightmares, they actually wake up and they will remember what happens. The night terrors are terrifying because they are sound asleep and they are screaming, and it is very upsetting to all people involved. You don't actually want to wake them up. You just want to like kind of stay with them and comfort them until they can calm down and go back to sleep. And again, Dr. Bassett might touch on this in a future lecture and we can circle back to that. But toddlers and school age children, just the routine and make sure the room is safe. With the older children, from like the double digits all the way through high school, we want to make sure that they are not overly stimulated before they go to bed. So let's not give them any caffeine. We recommend no caffeine at all, but if they do drink caffeine, make sure you stop it before 3 o'clock in the afternoon. You want to have, again, an established bedtime routine. You definitely do not want them on their iPads, their tablets, their iPhones too soon before bedtime, because that does stimulate them. The teenagers, I would highly recommend that you do not let them bring their cell phones into their bedrooms, because the text and the dinging and the Snapchat and the Facebook and the Instagram, it is very distracting, and their phones will be going off all night and they will not get a complete night's sleep. So these are just a few tips that I've learned through being a mom and being a pediatrician and just being in the office for the last 20 years. Hopefully some of these will help you. And if you have any questions, please feel free to reach out to us. And please follow Dr. Bassett on the Buzz. We always have great, interesting topics that are coming up. So thanks for watching and have a great week.